Thank you for joining us for this animal care webinar entitled, What All Attending Veterinarians Need to Know. I'm Dave Prouty, a training specialist for animal care, and I will serve as your facilitator for today's webinar. Today's presenters are Dr. Peggy Shaver, a veterinary medical officer for the state of Kansas, Dr. Sarah Tobias, a veterinary medical officer for Vermont, New Hampshire, and Maine, and Dr. Cody Yeager, a supervisory animal care specialist for Texas, Louisiana, and Mississippi. This webinar is being recorded, and you'll be notified when the recording is available for viewing on our APHIS YouTube. A copy of this presentation is available for you for download from the handout section of this webinar. Your questions are very important to us, and we anticipate a lot of great questions today. To ensure they are captured properly and you are provided with the best response, we will not be taking questions live during the webinar. Instead, we ask for you to please submit your questions during the webinar to the questions box. We will consolidate all of your submitted questions and disseminate them via email following the webinar. I will now turn it over to Dr. Betty Goldentire, our Deputy Administrator for Animal Care, for opening comments. Betty?
Thanks, Dave. And good evening, everyone. Let me add my welcome to our very first webinar specifically designed to enhance our partnership with the attending veterinarians. I'm delighted that you could join us tonight. This webinar is a kickoff of our increased efforts to improve animal welfare by collaborating with our most critical partner, and that is you all. I hope you had a chance to glance at the new website when you registered for this session. Animal Care's Center for Animal Welfare and our field operations staff collaborated to develop extensive web resources to inform the licensees and you all. We hope that the updated website will provide you with important regulatory information, the information that you need in a way that makes it easy for you to get to it quickly. And if you did have a chance to look through the site, you probably saw that there are several resources up there already. An optional template form for environmental enrichment programs for facilities that have non-human primates. Another example is a tech note on attending veterinarian roles and responsibilities, which you could use if you have a new associate in your practice or you have an intern, someone who wants to know about the attending veterinarian role. We also have several aids up there that you're welcome to use with your clients or however you like, including a review of heartworm disease, intestinal parasites, and flea control for dogs. I'm also really happy to take this opportunity to introduce Dr. Martha Keller, our new director for the Center of Animal Welfare. She comes to us with a lot of experience and leadership skills, and the website and these resources, they are just the beginning of what we're going to be able to accomplish together. Again, thank you all for coming. And with that, I'm going to turn it over to Dr. Peggy Shaver to get us started.
Thank you, Dr. Goldentire. Let's see if the slide will advance here. Okay, good evening and welcome to our presentation for attending veterinarians on the vital role of attending veterinarians to the success of facilities regulated under the Animal Welfare Act. I'm Peggy Shaver and I'm a veterinarian in Central Kansas. And as you heard already, I'm joined today by Dr. Sarah Tobias and Dr. Cody Yeager. The overall goals of this presentation are to define for you the relationship of the attending veterinarian, or often abbreviated AV, with USDA APHIS Animal Care, to give you an understanding of the authority of the attending veterinarian under the Animal Welfare Act, and to make sure you are familiar with the topics found on our new AV website. We'll do all this with the following topics. We'll present an introduction to USDA APHIS Animal Care and the Animal Welfare Act. We'll define the role of the attending veterinarian and what a regulated person or business must do to be compliant under the Animal Welfare Act. We will explain how to write a compliant program of veterinary care for a regulated facility. We will discuss how being an attending veterinarian might impact your professional practice. We'll review the new veterinary care requirements for dogs, and we'll show you various ways to reach out to animal care. So you're likely here because you already are or have asked to be an attending veterinarian for a USDA Animal Care licensed or registered facility. Thank you for serving in this position, because as we'll discuss today, the attending veterinarian is our critical partner in this mission to protect animal welfare under the Animal Welfare Act. We believe there are many benefits to being an attending veterinarian. Attending veterinarians are a trusted voice in their communities and represent many views on animal use. In some cases, veterinarians serving in the role of AV generate good public relations as a result of their involvement with facilities in the public spotlight. Attending veterinarians use their knowledge to advance animal industries and businesses while ensuring good animal welfare. In other words, we believe good animal welfare equals good business. Attending veterinarians can have the opportunity to learn about regulatory medicine and the role of the USDA in animal welfare, along with the potential to expand their clinical practice skills. Attending veterinarians also may have the potential to develop expertise and opportunities to serve as attending veterinarian at a variety of types of facilities if they choose. Veterinarians are an integral part of the One Health approach. Many animals regulated under the Animal Welfare Act are in potential zoonotic disease situations. This example is what led, at least in part, to the new rules for veterinary care for dogs under the Animal Welfare Act. And veterinarians in all capacities and types of practice promote animal welfare every day. Attending veterinarians facilities regulated under the Animal Welfare Act have the opportunity to expand that reach to include different populations of animals in our society. First, let's talk a little bit about the background of animal care. Animal care is a program in APHIS, the Animal and Plant Health Inspection Service, and APHIS is an agency in USDA. Many licensed veterinarians are already familiar with Veterinary Services, a different APHIS program, because of their important work with things like health certificates, animal movement, and foreign animal disease diagnostics. Animal Care is a different, albeit much smaller program in APHIS. Animal Care exists to work in three main areas. We work to ensure the humane treatment of animals covered by the Animal Welfare Act, frequently abbreviated as AWA. We work to eliminate soring and promote fair competition at events covered by the Horse Protection Act. And we work to provide national leadership on the safety and well-being of pets and other animals during disasters. But it's the Animal Welfare Act we're talking about today. The Animal Welfare Act licenses or registers facilities that use mammals in the following activities: brokers or breeders of animals for wholesale use. This includes some pet breeders such as dogs and guinea pigs, as well as breeders of some exotic mammals. Exhibitors of mammals. This includes zoos, circuses, petting zoos, and other animal exhibits. Biomedical research that includes the use of mammals. Commercial transport of animals covered under the Animal Welfare Act. And the Animal Welfare Act does also cover birds not bred for use in research. We are currently developing regulations to cover birds. I have a link here to the tool on our website that helps individuals potentially conducting covered activity determine their need for a license or registration. And we have a slide at the end of this presentation with this and all of the other links that we'll discuss today. You're likely already aware of what kind of business the facility you are partnered with is doing. Keep in mind, though, that some facilities with licenses that allow them to include multiple activities covered under the Animal Welfare Act in their business plans. Licensees and registrants that are regulated under the Animal Welfare Act are subject to unannounced inspections of their animals, buildings and structures, all aspects of their husbandry program, and required paperwork, all to assess their compliance with the Animal Welfare Act. Our inspectors hold the titles of either animal health inspectors, who are a variety of animal health professionals, or veterinary medical officers, who are veterinarians. The regulated facility you are working with should be able to direct you to an inspector if you'd like to discuss anything we talk about here today or have any other questions about the inspection process. So, an Animal Welfare Act regulated facility has asked you to be their attending veterinarian. That's great. Now what? The Animal Welfare Act relies on attending veterinarians and the important part they play in the welfare of animals in these facilities. So let's go through the details of the attending veterinarian's roles and responsibilities. First, however, you might be asking yourself, do I even qualify to be an attending veterinarian? Here are the qualifications one must meet to be an attending veterinarian. A graduate of an AVMA accredited school of veterinary medicine, or have a certificate issued by the AVMA Commission for Foreign Veterinary Graduates, or have an equivalent formal education as determined by the APHIS administrator. This isn't a common occurrence, but can be explored by writing to our office if you feel this situation applies to you. Furthermore, you must have training and or experience in the care and management of the species being attended to at the facility, and you must also be given authority by the regulated facility to provide veterinary care for the animal. We'll cover this a little bit later on in the presentation. But wait, your list didn't say I had to have a state license or be accredited. Isn't that a requirement? The Animal Welfare Act doesn't specifically require a valid state license in order to serve in the role of the attending veterinarian, and therefore you will not automatically be excluded from holding the position if you're not licensed or accredited. However, practically speaking, there are many things an attending veterinarian must do to fulfill this role that require licensure or accreditation. Attending veterinarians must follow veterinary practice laws for their state. But a veterinarian who is otherwise qualified can still serve as attending veterinarian if other veterinarians are delegated to perform these tasks under the attending veterinarian's oversight. We'll have more on this topic later, as there are many facilities who use the services of more than one veterinarian. I mentioned that one of the qualifications to be an attending veterinarian was to have experience and or training in the species being cared for. If you're asked to be an attending veterinarian for a facility with species you do not have previous experience with, be honest in your assessment, not only of your ability to acquire that experience, but also about your time available to serve in that role. Not everything you are familiar with in traditional private practice translates into working with animals in facilities covered under the Animal Welfare Act. In many cases, consultation with other veterinarians with species experience and veterinary specialists can satisfy the requirements of for this experience. Establish these partnerships early on. Waiting until an animal has a medical problem is too late. You need to ensure the adequacy of all aspects of care for the animals when you start serving in the role of attending veterinarian, not just when problems arise. Also, some facilities will hire additional veterinarians with different skill sets to work cooperatively under the attending veterinarian. Even if there are more than one veterinarians employed by a facility or working on a medical case, under the Animal Welfare Act, there can only be one captain of the ship, if you will, and the authority of that veterinary care ultimately falls to the one attending veterinarian. But as we discussed before, many veterinarians who assume the role of attending veterinarian for facilities with species or business plans outside of what they see on a day-to-day basis find the new experiences very rewarding. What are your clients' responsibilities required by the Animal Welfare Act for providing adequate veterinary care to their animals? While the role of the attending veterinarian is very important, ultimately, the ability of the facility to be compliant with the Animal Welfare Act falls directly and solely on that licensee or registrant. The Animal Welfare Act requires all of the following from regulated licensees and registrants. They must hire an attending veterinarian under formal arrangement. In some cases, this is a formal full-time employment contract. In some cases, this is a written program of veterinary care that you both agree to. There is more on this to come in the presentation. The licensee or registrant must give the attending veterinarian authority to ensure the provision of adequate veterinary care and to oversee the adequacy of all other aspects of animal care and use. The licensee and registrant must establish and follow programs of adequate veterinary care. Again, this is the plan developed by the AV that directs care for the animals and will be discussed in detail. Someone at the covered facility must perform daily observation of all animals and report any problems to the attending veterinarian. And finally, the facility must provide appropriate facilities and equipment for adequate veterinary care of the animals. Remember, all of these duties are done under your authority to direct how veterinary care is provided to the animals. That last bullet about providing facilities and equipment, that does not mean that all facilities that are licensed or registered under the Animal Welfare Act must have a fully outfitted veterinary clinic in the building. Nor does it mean that all animal licensees and registrants must be trained to do procedures on animals that you are not comfortable with them doing. For example, there are some exotic animal exhibitors that have training from their attending veterinarian on darting animals for sedation in case of an emergency. If you're not comfortable with that, or any other treatments or procedures being done at the facility you work with, you are not required to approve that. That leads us nicely to the topic of what it means for an attending veterinarian to have authority at a facility regulated under the Animal Welfare Act. The Animal Welfare Act states that the attending veterinarian must have authority to ensure adequate veterinary care and to oversee the adequacy of all other aspects of animal care and use. If you're not a full-time employee of the facility and therefore not there to do all the daily observations on the animals, it is critical that somebody at that facility is able to assess the animals for problems and then communicate those concerns to you. That communication of daily observation is critical for your authority to provide adequate veterinary care. Your authority also means that the licensee and registrant must adhere to the program of vet care written by you, the attending veterinarian, and to follow directions for care and treatment of animals, again given by you, the attending veterinarian. In private practice, you do your best to ensure that clients will follow your treatment recommendations in hopes of a good outcome, whether that be give ear medications as directed or do diagnostic blood work that you recommend. But ultimately, in those situations, your clients decide if they will follow your directions for care. With facilities regulated under the Animal Welfare Act, those recommendations or treatment directions given by you, the attending veterinarian, must be followed. If a licensee or registrant does not follow the program of vet care or other directions, they can be issued a citation for noncompliance with the Animal Welfare Act. Put another way, the Animal Welfare Act, the USDA and its inspectors do not instruct a covered facility on how to provide medical care for their animals. We determine if the facility is following the instructions and medical plans set up by you, the attending veterinarian. And with that, I'm going to hand it over to Dr. Sarah Tobias.
Thank you, Peggy. Hello, and thank you for joining us today. I'm Sarah Tobias, and I'm a veterinary medical officer who actually used to be an attending veterinarian. I learned by doing how to effectively fill out a program of veterinary care, and I'd like to share some tips and pointers with you that I was given along the way. Hopefully, this will spare you from making some of my early errors. A written program of veterinary care is required for all facilities without a full-time vet and for those facilities with dogs. We do provide a form for your convenience and a form that's specific to facilities with only dogs, but you do not have to use these official forms. If you have another document that defines the program of veterinary care, you can use that as long as it covers all of the required topics for the program as outlined in the Animal Welfare Act. In the next slides, we will go over how to fill out the form for a program that includes multiple species of animals, and then discuss the form that is used for dogs specifically when that licensee only has dogs. Just to be clear, If your licensee has multiple species, they do not have to use both forms, but can just use the multiple species form 7002 with the corresponding pages. Here is the single most important tip that I can give you. Download before filling out the form. Here is why. We provide these forms as PDFs on our website. So that individual information is not shared, these forms will not save your information if you enter the information in the form without downloading it first. Again, here's a warning. If you do not download, then save the file before you fill it out. You will lose all the data you enter. And believe me, that is incredibly frustrating. We strongly recommend saving a blank copy under the name of your facility before you enter any information as well, so that you can use it for updates and clarifications in the future. Let's see here if the slides will cooperate. The form is intended to be self-explanatory. Sometimes a licensee will want to assist the AV by filling out the form for them. This is fine, but the actual instructions in the program of veterinary care must come from the veterinarian. And that responsibility starts with the AV's decision of how often the facility requires visits to maintain the animals appropriately. This information is entered here on page 1, and all inspectors will check to be certain these directions are followed by the facility at the time of an inspection. For programs with more than one practice involved in maintaining the program of veterinary care, there's space to note that on this first page as well. You may also wish to note if there are attachments to the program of veterinary care and what they're called, and that information could go in the bottom box here, although there are multiple places to note it on our additional pages. Page 2 of the form gives spaces to fill out the required information. This is for dogs and cats. If the program does not have dogs and cats, please check the circled box on the top left to indicate that this page is not applicable. There's a vaccine section that separates the components of commonly given compound vaccines by disease, and some programs will give these vaccines separately, like lepto and parvo. You can always note NA here if any of these are not given. Similarly, if there's not enough room to include a detailed program of vaccination and frequency at which vaccines are given, you can attach a sheet giving those details. Please note that then there's a section that discusses not only anti-parasite treatment, but the testing method and frequency of testing for evaluating parasitism in the colony. We really do want to know these details, so please fill this out as completely as possible. The next section asks for information on the method of humane euthanasia for the facility, and we encourage you to write down these methods in detail. Some AVs will authorize the licensee to perform euthanasia. If that is the case, please make sure to give details on this in the section, including specific drugs, doses, and methods. Your inspector will be checking to see that the facility is complying with your instructions. And down on the bottom here, we have a list of suggested husbandry topics for discussions with the licensee. You do not have to cover them all, only those you feel are applicable to the facility. And remember, as the AV, you are the final authority for the facility on these practices. So you may have additional topics as well, and if there isn't room to list them, we suggest you attach a page. Page 3 of the form gives spaces to fill out the required information for wild and exotic mammals. Again, if the program does not have these species, please check the circled box on the top left to indicate that this page is not applicable. This page separates out groups of animals by species for you to add details for that group. For example, you might want a space to note that there's an enrichment program attachment in the primate section. Additionally, we have an example of language here. That can be used by an AV If authorizing the licensee to perform euthanasia in certain circumstances, such as an emergency, when they feel specific details might be considered as too sensitive to list here. For example, this form states that if a specific circumstance occurs, the AV has authorized trained personnel on site to use alternative methods under the methods of euthanasia. If this is not too sensitive for you to give the details, please put as many as you possibly can in this section, including the specific drugs, doses, methods, and who is specifically authorized to use these methods. Down on the bottom here, we again have a list of suggested husbandry topics for discussion with the licensee. As always, you are the final authority for the facility on these topics or practices. You are not required to authorize any procedures you are not comfortable with or that are not required under state law. And we give an example of that here where it's noted that TB testing is not required for hoof stock at the facility in the bottom box. Page 4 of this form gives places to list other species that are not domestic dogs or cats, nor wild or exotic mammals. And again, please note there's a box to check on the top left if the page doesn't apply to the program. The example we have here is that of rabbits. A program of veterinary care for rabbits or other domesticated livestock might very well have specific requirements for their care that differ from those of the species listed previously. As always, if this information does exist in another document, you may simply refer to that document and attach it. You don't have to duplicate it here. In particular, these domestic livestock species and other mammals might have different providers for emergency care or euthanasia, and that should be noted in the boxes with the arrows on the left. Additional husbandry topics for these species could differ significantly from others. For example, in a rabbit program, it might be important to discuss pasteurellosis, pododermatitis, and malocclusion with your licensee to ensure that they have a good understanding of these topics to ensure animal welfare. If those discussions lead to a standardized treatment protocol for those specific conditions, you might refer to that here and then attach that protocol. And here we have an example of an attachment that would apply to a population at a facility that has a really wide variety of animals. The veterinarian developed a vaccine schedule and provided guidance on the frequency of immunization, as well as the frequency of hoof care, deworming, and notes on other things that might need to be considered at different times, such as if there is the spread of rabbit hemorrhagic virus into the state, which would give them a reason to want to vaccinate the facility's rabbits. These two pages, these two examples here, page 2 and page 3, come directly from the form developed for dogs, 7002A. The first page on that form is essentially the same as Form 7002 for multiple species, with a space for the AV to sign the program. And these two pages do differ from the other form and provide spaces to give details on the special requirements for dogs. For example, there's a place to list the frequency of the minimally required once annually head-to-tail physical exam for adults or juveniles at the top of the page. There's space to describe the vaccine schedule in detail. And the vaccines required under the Animal Welfare Act for dogs are listed out separately: parvo, distemper, rabies. There are reminders about what parasites are called out in the Animal Welfare Act that must be covered in the program of veterinary care, for example, worms, giardia, and coccidia. And then there's specific places to describe the routine husbandry care to be in compliance with the Animal Welfare Act. The care for hair, coat, nails, eyes, ears, skin, and teeth. There's a place to discuss instructions for how to handle difficult animals. And this form has additional room for euthanasia methods, one for veterinarians and one for licensees. And lastly, the details or suggestions in the final section include the important topics for managing a dog facility, such as quarantine, nutrition, drug resistance, congenital conditions, venereal disease, and drug management. Just as we provide Form 7002A for your convenience for a program of veterinary care for dogs, we also have a form provided to you for an exercise program. It's intended to give a reminder about what the Animal Welfare Act defines as the required space allocations in reference to exercise. As you can see in the language on the top box, there are boxes to check based on options for individually or for group housed dogs. If that section does not apply, or there are additional parts to the program, then that can be entered below in Section 3. Facilities with primates are required to have an environment enhancement plan that is directed by the attending veterinarian. Animal Care has also provided an optional form for this for non-human primates. The form gives a reminder of the regulatory requirement at the top of each section and then breaks up the program into some common methods that are used to meet the required components. As I hope you can see, with a written program of veterinary care, there are lots of ways to do it right. What we evaluate is compliance with the regulations under the Animal Welfare Act. And the written PVC, or Program of Veterinary Care, when done in detail, allows us a very good way to evaluate the facility's ability to maintain compliance with your instructions. The relationship between the AV and the regulated facility is fairly unique, and often the AV delegates procedures like vaccination and ear cleaning or even euthanasia to the licensee or staff at the facility. I'd like to remind you that euthanasia is defined under the Animal Welfare Act as the following: the humane destruction of an animal accomplished by a method that produces rapid unconsciousness and subsequent death without evidence of pain or distress, or a method that utilizes anesthesia produced by an agent that causes painless loss of consciousness and subsequent death. Methods of euthanasia that are listed as acceptable and covered under the AVMA guidelines of euthanasia meet this definition. However, in certain cases, there may be alternative methods that are not covered by the AVMA guidelines that you as the AV approve for the facility to use for euthanasia. That's okay. The inspector will probably call you and ask you about how you determined that method to be appropriate and humane, and who you have determined is the appropriate person to apply that method. But that doesn't mean that you as the AV cannot instruct the licensee on alternative methods. As mentioned before, it's been very useful for some AVs to delegate routine treatments to licensees. If there are common conditions for which you have a standard treatment, it makes sense to empower licensees to start or administer treatment within your guidelines about when it's appropriate. We've seen some really great treatment books with pictures of common conditions and treatment protocols used to very good effect in various facilities. And it can be a both efficient and effective method of ensuring animal welfare. We do want to remind everyone, however, that it is critical to make sure that your licensee knows under what circumstances they are allowed to do this and for how long. Please ensure the licensee understands when it's okay to start treatment, when to ask for help, and what to do if the treatment doesn't work. And of course, you are not required as the AV to empower any license to perform veterinary care if you don't think it's appropriate. USDA APHIS Animal Care also provides materials for the education of your licensee. You can use these at your discretion to provide background to support your directions in the program of veterinary care. Please remember that there's more to an adequate program of veterinary care than a well-filled out form. A facility's program must include all of the required elements under the Animal Welfare Act for the program of veterinary care, as these reminders state here. We will look at all of these elements: the availability of appropriate personnel, facilities, and equipment, the methods used to prevent and control disease, including emergency care, the daily observations of all animals, the availability and provision of guidance to personnel who are doing the day-to-day care of the animals, and of course, the presence of adequate pre-procedural and post-procedural care. One size, in this case, does not fit all. And we recognize and appreciate the additions that you may need to make for the written program. Additional information may need to be added to our forms to fully meet the requirements. Thank you for your time and attention tonight. We really hope this is helpful information. I'm going to turn the presentation over to Dr. Yeager now to give more information and details on the role of the attending veterinarian.
Thanks, Sarah. Hi, I'm Dr. Cody Yeager, a supervisor located in Dallas, Texas. It's great to talk with you today. I'm going to finish us out and then provide time to ask questions at the end. So you might be wondering, what is the AV's role in the inspection process? Am I, the AV, expected to be present for these inspections? Absolutely not. We understand you have other clients and possibly a business to run, so you might not be immediately available during the inspection. That being said, if you are, it's a great opportunity to have an in-depth conversation, answer any questions, and get on the same page on what the expectations are of everyone. The majority of non-compliances I've seen related to vet care usually boils down to miscommunication and a lack of understanding. By having the AV join the inspection or the summary at the end, it usually greatly improves understanding and compliance of the vet care requirements listed in the Animal Welfare Act. Additionally, having the attending veterinarian present on inspection allows us to ensure the facility is providing you, the AV, with the sufficient authority that Dr. Shaver already discussed. If you are not present on the inspection, inspectors will use the program of vet care along with other documents such as receipts from your clinic to verify sufficient authority is being given to the AV to maintain adequate care and welfare of the facility's animals. If inspectors still have additional questions that the paperwork does not answer, they may reach out to you. But now this is the key point here. The more that's written down allows us to verify the facility is giving you, the AV, adequate authority and providing adequate vet care, which ultimately means we don't have to follow up with you as much directly when it's documented in writing. Now, this question comes up frequently from AVs. Will noncompliances at a facility that I'm an attending veterinarian for affect me in any way? Let me be very clear about this. The Animal Welfare Act gives no regulatory authority for USDA to pursue any legal action over individuals in their role as an attending veterinarian. Additionally, your role as an AV could not affect your accreditation with USDA in making health certificates. What about being associated with a facility that is getting criticized by the media? This is a real possibility, and most likely the facility will ask you to speak on their behalf if their vet care program is being called into question. Ultimately, your reputation could be impacted. Remember, as the AV, you always have the authority to ensure adequate vet care of the animals of the facility, and there is no obligation to continue being an AV for any facility you feel uncomfortable in serving as their attending veterinarian. While USDA has no authority on what news media can publish, it does bring us to our next topic, the Freedom of Information Act, also known as FOIA. Another common question we hear from AVs is if their medical records could be released to the public. The answer is possibly, but not usually, and let me explain. Any records that USDA has in its possession may become publicly available through the Freedom of Information Act, or FOIA. Now, inspectors will review a facility's written program of veterinarian care and any associated medical records during an inspection, but the records generally remain in the possession of the facility and/or veterinarian, and not subject to FOIA requests through USDA. The one exception in this is if a citation is issued. In this case, supporting documentation may be copied to document the citation. Those records would be uploaded to the Animal Care database as part of the inspection. Because these records would now be in USDA's possession, the database, they are subject to disclosure under specific requests per FOIA. Records simply reviewed on inspection are not generally considered under USDA possession and not subject to FOIA through USDA. This is also the reason why it's very important you understand whatever you communicate in an email or text message, which is saved to the USDA server, could also be made available to the public through the FOIA process. It might be better to make a phone call instead and only send records to USDA if we request it. Personally identifiable information, PII, such as the vet's name, phone number, or address, is redacted before the records are made available to the public. But if you have concerns, you can remove that PII information. One last thing on this. Federal laws do not supersede state laws, and some states have additional laws that require more public knowledge on the documentation about facilities. These requirements are usually for facilities that get some type of tax dollar assistance, such as a state-funded university. The new veterinarian care section for dogs, section 3.13 in the regulations, was published in the Federal Register May of 2020 and then went into effect November 9th of 2020. I know Dr. Tobias already touched on these when going over the program of vet care, but let's take a closer look at these changes again. The written program of vet care for dogs must now have scheduled visits by the AV not less than once every 12 months. A complete head-to-tail physical exams must be performed on all dogs not less than once every 12 months. There must be vaccination schedules for contagious and deadly diseases, including rabies, parvovirus, and distemper. Additionally, there must also be schedules for sampling and treatment for parasites and other pests, including fleas, worms, coccidia, giardia, and heartworm, must be included in the program of vet care. And finally, the program of vet care must have a preventative care program to ensure healthy and unmatted coats, properly trimmed nails, clean and healthy ears, eyes, skin, and teeth for dogs. Medical records are required for dogs and must include the identification, records of routine husbandry, such as any vaccinations or preventative medical procedures, testings, or treatments done to the animal, and a description of any clinical veterinarian issues. As a reminder, your individual state may have additional medical record requirements. Since rolling out the new rules for dogs over a year ago, these are the most common questions we have gotten, but if you have additional questions, please ask them at the end. The first question, does the AV have to be the one to administer the vaccine? No. If the AV is comfortable with the level of skill and equipment of the facility to perform the vaccinations, then the AV is not required to be the one to administer the vaccine. However, some states do require that a licensed veterinarian be the one to administer certain vaccines. Next, is rabies vaccination required for indoor kennels? Yes. A rabies vaccination scheduled for kennels is required regardless of housing. Next question. What if a dog has had reactions in the past to vaccines? Answer is, an AV can exempt any individual dog of the required vaccines due to medical reasons. However, an entire kennel cannot be exempted of the required vaccine. Next is heartworm testing, sampling, and prevention required for indoor kennels. Dogs are required to be sampled and treated in accordance with the schedule approved by the AV for parasites, including heartworms, regardless of the housing. Heartworm prevention is not required, but recommended. And finally, if a dog had a physical exam done by a vet other than their AV, does that count towards the 12-month exam? Yes, the AV can delegate his or her responsibilities to another veterinarian to conduct the physical exams as long as all the relevant information is provided to the AV. So I know we just gave you all a ton of information, and you might need to reach out to us if you have any follow-up questions about these topics or future topics. So how can you contact USDA? Here are the main ways. The first and best way is simply reach out to the inspector assigned to the facility you're providing services for. If you don't have that information, the facility should be able to supply that contact to you. Next is contact someone like myself, a supervisory animal care specialist. There are 14 of us throughout the country. In the resource section at the end of the presentation, there is a link that takes you to a list with our names and email addresses. Another way is to contact our office in Fort Collins, Colorado, either by email, animalcare@usda.gov, or calling 970-494-7478. And finally, if you need to file a complaint on a USDA inspected facility or believe someone is conducting activity that requires a license or registration, you can file a complaint on our website under the File an Animal Welfare Complaint tab on the left side, or using the link listed in the resources. You can choose to remain anonymous. However, providing your contact information will provide animal care staff a way to contact you if we need additional information. Here is a summary of what we've talked about. We first introduced you to USDA APHIS Animal Care and the Animal Welfare Act. Next, we define the roles of the attending veterinarian and what a regulated person or business must do to be compliant under the Animal Welfare Act, specifically for vet care. Then we explain how to write a fully compliant program of vet care. Following that, we discussed how being an attending veterinarian might impact your professional practice. Next, we reviewed the new requirements for dogs and the common questions and answers. And lastly, we went over the ways to reach out to animal care. I included a list of websites we referenced in the presentation here. Furthermore, you can navigate to any one of these websites from our main animal care website listed at the top. As a USDA employee in animal care, I, along with all my colleagues, know the importance AVs play in not only keeping compliant with the regulations, but maintaining the animal welfare program at a facility, its success as a business, and what public opinion thinks about a particular facility or part of an industry. Attending veterinarians really are the key to making this work. Thank you so much for your time today, but most of all, thank you for the service you provide for the facilities we inspect. Also, thank you to Dr. Betty Goldentire, Dr. Rosemary Shifford, Dr. Elizabeth Theodorson, Dr. Robert Gibbons, Dr. Gwynn McGinnis, and the rest of the team and Animal Care for their help with this presentation and developing the web pages geared for attending vets to use, which I listed the address below. Again, your questions are very important to us, and we want to make sure we're capturing all those great questions and are providing the best response. Please use the question box to submit your questions. We will keep the webinar open for additional time to make sure everyone has time to get their question in. We will follow up via email with the answers to your question. That's it for me. Back to you, Dave.
Thank you, Cody. I'd like to thank our presenters, Dr. Peggy Shaver, Dr. Sarah Tobias, and Dr. Cody Yeager for their presentation. You will receive a survey following this webinar, and your feedback is vital to improve this presentation and is greatly appreciated. As Cody said, we will keep the webinar platform open for an additional 10 minutes to capture your questions. This webinar recording will be available on the APHIS YouTube channel, and a link will be posted on the Attending Veterinarian website as well for you to access when the recording is available. Thank you for attending, and that concludes today's webinar.